Hey everybody, we're back. This is Fertility Tip Tuesday. I'm about to have Dr. Raquel join me. Today's topic is narrowly focused on smoking and the negative impact it has on fertility, but we are going to open it up to questions about other things you might be putting into your body that you think is healthy that actually isn't. So as Dr. Raquel joins, just a quick reminder, Fertility Answers app platform is available, free to use. You can ask any questions you want. We have all volunteer professionals who answer questions for free. So please be patient if you don't get your question answered in the time that you wanted. We do have a rush category in case it's an urgent topic. There she is, the beautiful, the fabulous, the brilliant Dr. Raquel from Fertility Advantage. We're so psyched to have this conversation with you today.
I'm so excited. I'm pumped.
Yeah, me too. So, you know, this topic doesn't pertain to everyone, but it probably pertains to somebody that we all know, right? And so I think that we need to talk about smoking, and let's start with kind of the impact on the brain and how smoking trains the brain to then desire more smoking.
Right. So smoking, just like chocolate, it creates this awareness in our pleasure center. So a lot of times people associate that with like Instagram likes. It's because all of that tells our brain like, oh, this makes me feel good. This is going to be your dopamine. So cigarettes do the exact same thing. They kind of make you have this feeling of euphoria. And so a lot of people grow dependent on it because this hormone is constantly being released because now it's become a habit and it's the one thing that makes you feel good. So your body wants more of it.
Right. Got it. Okay. But chocolate can be good.
Chocolate can be good. Chocolate can be good.
So there's lots of things that are in the chocolate category that can also trigger that dopamine response. It is good. Sex is one of them, correct?
Exactly. Exercise. You know, most of the time it's a post-run euphoria that people tend to feel. But yeah, exercise too. Exercise, sex, things like that.
Well, I think that's what we want to focus on too, especially with how bizarre 2020 is like, what are those things that are, you know, that are dopamine triggering in a good way. But then there are other things that are in that addiction category that are bad habits that we think are just our vices that actually can be super detrimental on our fertility outcomes. Smoking is one of them. Can you talk a little bit about nicotine and tobacco and what that impact really is on fertility? Why is it so toxic?
Yes. And this is such an important topic because so many times we see people on TV, on commercials, they always tell you, you want to make sure you're taking your antioxidants, you're eating your antioxidants. And it's because this is what smoking does. Smoking creates free radicals in your body. What these free radicals do is they affect your cells. They literally cause DNA damage to your cells. And so what the free radicals do is they oxidize these cells, making them unstable. And these cells can become cancerous cells. And that's all from oxidation, from free radical exposure. And that's what cigarettes does. So if you think about your eggs are the biggest cell in the female body. So when you smoke, now you are allowing these free radicals to affect your cell. And that's what's affecting that DNA damage, which leads to premature ovarian failure. It affects the quality of eggs, miscarriage, and things like that.
Well, and same with sperm, because we're talking about the sperm DNA, right? At that level, that those gonatotoxic things like tobacco and so forth. Is there any level? What if you have a cigar smoker who's like, I only smoke a cigar once a month?
Yeah, it's so cool. I saw this article actually on Very Well Family, and they were just saying that it's not really 6 cigarettes versus 3 or 1 cigar versus none. Whenever you expose your body to free radicals, we already get them from the environment, right? We're already exposed just from being outside. So now you're consuming something that's giving your body a little bit more damage. And in a critical time, like doing IVF or IUI, when you have this small little window, you don't want to expose your body to anything that can affect you long term, because a lot of research shows that even when women smoke earlier, it affects their fertility later in life.
Wow. Okay. So there are ways to detox, but before we even get to that, why don't we back up a second and kind of cover some of the things that people are experiencing or might also be putting in their body, like marijuana. It's not just nicotine and cigarette smoke and vaping, but marijuana and maybe some foods and some plastics and some other, environmental things. Like in Bakersfield, everybody is got fertilizer toxicity, which is a really huge problem with the environment. So what are some of those other examples of things that you see in your practice that people are dealing with that are damaging their fertility outcomes and potentially DNA, that they need a lot of free radicals to overcome?
Yeah. So most often what I see is, even when I'm testing heavy metals, arsenic from cigarette smoke is something that pops up often. I can always tell, even if someone lies and says they don't smoke, I'm like, well, how else did you get exposed to arsenic? It's kind of,
right.
it's very particular. Then finally they'll say like, oh, from smoking. But yeah, to me, it's because of the heavy metals from the environment. So like you said before, like things like plastics can allow like lead, which is a very, very huge heavy metal, to get into our bodies, and our bodies absorb these heavy metals. But I see it most often from a lot of working women. A lot of working women take their food with them to work, and then they warm up their food in these plastic Tupperware containers, and they don't even think about it. But think about doing that every single day for 5 or 6 years. Now your body has built up this like reserve of heavy metals. So yeah, so it definitely affects you in the long term. But what I see most often is unfiltered water, buying produce and vegetables that aren't organic, and then using plastics.
Got it. Okay. So let's actually, send it out to everybody who's watching, who's tuning in. I saw a couple of my friends join too. Andrea Bryman from Bryman Consulting. She's amazing. Hello, my friend. I haven't talked to you in forever. And so let's open it up to them. Are there things that you all, the community, are struggling with, or that you're worried about in your environment? I brought up Bakersfield 2 days in a row because it's been weighing heavily on my mind. We have just hundreds and hundreds of acres of farmland, and they've been spraying fertilizer toxins over the whole land for many years. And so a lot of young people are now dealing with that infertility that is environmentally induced. And it feels the same as if they had been smoking for 20 years or grew up in a household full of smoke. Is anybody dealing with that out there? Did anybody grow up in an environment that you're worried about, and you feel like that might be impacting your fertility? Or are you concerned about the price of organic food? What are some of the things that are weighing heavily on everybody's mind? Now, the other thing, as we're waiting for questions to kind of come in, is when you had mentioned to us in kind of our prep work that women who smoke go into menopause 4 years earlier than non-smokers.
Yes.
Which is nuts.
Yes, but when you think about it, it's because of what this cigarette smoke does. Just like inhaling fertilizer. So many times people don't realize, they're like, oh, I work in this field, or I live next to a field, or it's near my community. It's because you are inhaling these fumes. And so when you're smoking, you're literally taking this into your body. And then those free radicals that you get from smoking, they literally can change the DNA of your cells. When you think about that impact, that's not something that you do and it can go away. When you affect your cells at 28, and we know as women, we don't get more eggs. The eggs we're born with are the ones that we have. So if you're smoking cigarettes at 25, and I know this sounds like a lot, but when you're smoking at 25, 26, you're damaging the DNA of your eggs, period. You don't get new ones to fix. You're damaging the eggs long term. So if you're 25 and smoking, there's no way you're going to have the beautiful skin of Dr. Raquel, who I am so envious of because she has the most delicious skin. I mean, you should literally have a Revlon ad or something, or some kind of thing. I'm like, every time we're on an episode together, I'm like, I need laser. I need something. Thank you. We do have somebody who wrote in, dear Fatima, that wrote in. She didn't grow up in an environment, but she was exposed to pesticides during her pregnancy, and she suffered a miscarriage. So that's just devastating, because you feel like you're doing everything right, but if you're exposed to high levels of pesticides, and I mean, I would want to sue somebody for, involuntary manslaughter. I'd be so angry, and I'm sure, Fatima, you are too. You get that far, and you feel like there's just, some things that are so out of control. Yeah. Do we have built-in detoxifiers that are even strong enough to deal with things like pesticides? Yes. So that's the function of our liver. So what's supposed to happen, which is why liver support is so important, is what's supposed to happen is that when we ingest a toxin, our liver is supposed to jump into attack to get rid of these, anything that's damaging, any toxins. That's our liver's job. But our liver is so overwhelmed already from what we're eating, what we're drinking, going outside, breathing in air. So whenever your body ingest something like a pesticide or inhale something like a pesticide and it's already overwhelmed, it can be a lot for your body to handle, which is why so many naturopathic doctors and so many people, period, stress the importance of antioxidants. Because if you're consuming these, no matter what you're exposed to, your body has like an added defense to fight these toxins and things like that.
Okay, that makes sense. So we have one of our community members, CL Mayfield. Great to see you again. She popped on yesterday. So she's asking a fantastic question. If we don't know if or how much we've been exposed to, is there a way to be tested, and what can we do to detox? And I'm about to embark on this journey with Dr. Raquel myself. So why don't we go through what you're going to test on me so that I know the same thing that CL Mayfield is asking?
Absolutely. So when it comes to doing some deep dive testing, not only do we look at heavy metals, so the heavy metals that we look at are going to be the top heavy metals that are found in the environment, in food, and in water. So we test for lead, mercury, arsenic, cadmium, and tin. So we look at that first, and we get it through blood and urine. So it's a very amazing test. And then not only does it look at heavy metals, but it also looks at gut function. So it looks at how your gut is functioning. Are you able? It's so cool. It looks at how you take in carbohydrates, proteins, and fats. And it literally shows us through the Krebs cycle how your body is breaking down this food, or how your gut is breaking down this food. That's amazing. It's amazing. And then it kind of tells us about inflammation and things like that. And then the last piece is telling us about your micronutrients. So it looks into if you're eating food, are you actually absorbing the things that you're eating? It's a very in-depth test. I'm super excited. And
I'm going to share all this with our community. So as Dr. Raquel and I go through this, I always feel like I need to hold my breath past, if I'm passing like a group of people who are smoking, right? I'm like, don't get in. But we absorb it through every area. We absorb it through our skin. And so I think that, knowing how well we're detoxifying will also kind of indicate not just what our levels are in terms of exposure. Yeah, my mind is blowing too, CL Mayfield. But also maybe how well my own detoxifier is working, right? And if I need to do a liver cleanse or something like that. Dr. Gluzhovsky is one of our, thanks for joining. Demian, it's good to see you. He's one of our fertility experts on the Fertility Answers app platform, who's coming in to say hi, and he's based in Argentina. He does a lot of egg donation cycles. So if anybody wants really affordable egg donor treatment. So it's great to see you. And yes, Fatima, test. So if you want Dr. Raquel to test you, she can send out all the lab requisitions that you need. And she can be the one that analyzes your data. Just pop over to fertilityadvantage.com and request a consult with her, and she'll get you set up with all that testing stuff, etc. So yeah, this is, these things are kind of incredible. So let's assume that I've got some detoxing to do before I do my embryo transfer. What does that look like? Am I going to be taking a bunch of things that taste like tree bark?
That's so funny, because one time one of my patients was like, it just tastes like soil or something. But I have like about a 6 to 8 week protocol that I like to give. And I can change it depending on your cycle, but what I like to do is to first and foremost detoxify your gut and your liver. And so that comes in the form of pills and shakes that you'll take for about 14 days. During this time, I also give you a diet that further enhances your natural detoxification, because we don't just want the supplement to help your body detox, but we also want to give you the nutrients so that your body naturally pushes these things out. So you're doing that, you're getting natural detoxification. And then once we finish the detox, now we replenish your body with what it needs. So with probiotics that your gut needs to function and help you with your fertility, and just giving you nutrients to kind of replace the things you lost in that detox.
Oh, interesting. Okay. So I'm just imagining some yucky stuff coming out.
That's the number one thing. Process. That's the number one thing.
Come out of my skin, out of my body. Oh my goodness.
Breaking out. So many people don't realize this, but when you're detoxing and you break out, that's a good thing. So
it shows that it's working.
Exactly.
Yeah, get it out every fashion.
Yeah.
One of the questions I do have is then when you're in that kind of rebuilding phase, how long after you do the detox is going to be that ideal window kind of following your plan before I do the embryo transfer? Because I'm kind of in a hurry. I mean, I'm just not getting any younger, and I don't know what happened. I hit this thing emotionally where it's I got to do this embryo transfer now.
Yeah. Yeah. So the detox lasts about 14 days. After that, we immediately start rebuilding your stores. So normally about 4 to 6 weeks. So it's about 6 to 8 weeks total. But about 4 to 6 weeks after is when you start seeing actual effects. You start to feel better. Even during the detox, one of the most amazing things that I love is that my patients adopt this behavior of like, I'm eating so many more vegetables now, so much more protein and healthy fats, and they even look good. They look good, they feel good, and so it encourages them to continue this long term. So yeah, about 6 to 8 weeks is the normal window. Yeah.
All right, that's not so bad. I can handle that. That's about the amount of timing I feel like I need just to line up all the appointments anyway. So, and then once I do that embryo transfer, are these same types of things that I'm going to learn in the experience with you, are they also going to carry me through the pregnancy?
Right.
Support a healthy fetus?
Yeah, so that's such a good question, because a lot of women who are trying to get pregnant, they always feel so nervous reaching out to me because they're like, on this detox kit, it says do not do if you are trying to conceive. And what I try to explain is like, that's a natural warning that should be on it, because you don't want anything contracting your gut when it's a baby inside of it.
Yeah, exactly.
But to me, you don't want to bring a fetus or an embryo or a baby into an environment that is toxic, because it'll affect your fetus long term. So yes, I definitely make sure that the behaviors you adopt during the detox are long term. It's nothing that you have to take that will affect you or your baby.
Got it. I used to say that I wanted a second chance at pregnancy just to do like eating and the environment right. I wanted a round two because when my first son was born through through a frozen embryo transfer, he came out with a rash on his face, and I was that's not normal. You know, like I just felt like he was exposed to things in my uterus that he wasn't supposed to be exposed to, and then later, of course, when he was 2 and we both went on this holistic journey together to get well, we learned that my implants from my breast reconstructive surgery from having had cancer was making me very sick. And that toxicity absolutely was crossing the placenta barrier. And, brave little kiddo. So there were some epigenetic things for him, and we need to do more research on that and more studies. But I will, I've been very public about my journey with how breast implant illness impacted me during the time that I was pregnant. Now they are out, and so I'm excited to embark on this, the second one, and kind of get another chance. Although I will say that, when you do hit that first trimester, for me, my food aversions were so intense that it was hard to like do anything right. It really was. So, but we'll be tracking all of that in our community. This is another great question from CL Mayfield. We're talking about this for fertility, but do you recommend this testing for husband and children or her parents' age? Because it's such a great question, because she's expressing so much love for like the whole family, and the whole family is going to be impacted by these things and by these not just environmental toxins. My mother grew up with secondhand smoke, which triggered asthma. So, all of those things are definitely impacting everyone. You have a special focus on fertility, but you will work with the whole family.
Oh, absolutely. Absolutely. Now, children are a very special category, so you have to be very careful. I don't focus in pediatrics, but I do know a lot of colleagues that do. And for them, they always focus on natural detoxification factors. So giving the body B6 that's used in like the second phase of detoxification by your liver, giving kids things like that are a little more safe. I would never give a child like a full 14-day detox, because it's a bit too harsh for their bodies.
Sure.
But men, they love it. Anytime they come with their wives, they're always just like, oh, wait, this is really cool. I want to do this too. So I think that's a great idea to have the whole family tested to come up with a plan together.
Right.
Yeah.
Exactly. Yeah. And then they can hold each other accountable to kind of the healthy habits and the changes that they need to make. And it's just easier that way, right? Than moms being responsible for everything.
Yeah.
The other thing that I was considering just with that is that there's a lot of kids that aren't on probiotics, and in probiotics itself has been just a huge advantageous journey for my son, who's going to be 7. And because we also have, kind of this epidemic of overprescribing of antibiotics and how much that impacts gut health, right?
Yeah.
I mean, I feel like, children's taste buds, I wish somebody would do a study on this. I have a hypothesis that children's taste buds are thrown off when they've had too many antibiotics, and they can't taste food the same.
That's really cool.
I know this chemical taste from when I went through chemo and I was on all those medications, you know, during those years, and I couldn't taste anything. And I think about that with kids, like, you know, kids who aren't adventurous eaters. And my son loves the taste of actual food. He doesn't want to cover it up just with cheese or with sauces or whatever.
That's so awesome.
It's my hypothesis. So we'll have to do a study to see if I'm right.
That is so cool. I know.
How do you teach like a 5-year-old to communicate a taste, you know, profile? I don't know.
Exactly. No, you should definitely do it. That sounds awesome.
Yeah. So do we have any other questions, you guys, before we wrap up? We have a hard stop today at 4:30, unfortunately, but you can hop on to Dr. Raquel's website, the Fertility Advantage. She's available on Instagram too. So follow her, DM her. You can check us out on the Fertility Answers app if you haven't already downloaded and registered there. We have our free fertility navigators available to you, navigators at MedAnswers.com. We have a different company name from our product name, which sometimes is confusing. We're going to actually fix that this year. But we're so grateful for this community, and we're just here to support you in any way that we can through education, inspiration, and access to amazing docs like Dr. Raquel and Dr. Chen and Dr. Glujovsky, and resources like Bryman Counseling as well. So thanks, everybody. We'll see you next week. I actually have another show happening on tomorrow afternoon, I believe at 3 p.m. Pacific, but Dr. Raquel and I are here every single Tuesday, 4 p.m. Pacific for Fertility Tip Tuesday. Thanks, everyone.
Bye.
We'll see you. Bye.